video as a follow-up to a recent video in which someone asked, are there any specific poses or concerns, things that need to be avoided or adjusted for people with rheumatoid arthritis? The short answer that I provided is, one, check with your doctor who knows your arthritis best. Two, don't do anything that makes your arthritis pain worse. And three, listen to your intuition, internal cues, and know the difference between sensation, that may be the engagement of a muscle, and arthritis pain. It was brought to my attention by a colleague that I had missed an important point, which is something I've been aware about and just failed to mention. So I'm going to record this to highlight an additional issue affecting people with rheumatoid arthritis in particular. So this is at the joint of C1, C2. So it's the atlas and the axis of the cervical spine, the first two vertebrae of the spine. And the way that they're organized, you have the C1 vertebrae, which is, like this, and then C2 is another ring, but it actually has a protrusion sticking up from that ring that keeps C1 and C2 connected to each other. So there are two problems that can arise at C1, C2 for people with rheumatoid arthritis. One is laxity of the ligament that wraps around that process and sort of holds it in place. So if I do a view like this, so there would be a ligament right here that sort of holds that protrusion in place. And if that ligament is missing, then there could be movement where the first vertebrae moves forward of the second vertebrae. Oh, I'm not showing that. Okay, so like this, where the first vertebrae moves forward because there is not a tight ligament holding that in place. Okay, so ligament laxity can be one reason why C1, C2 is unstable. Another reason is that this process can be worn away, it can be fractured, it can be damaged in some way. And so if you have less of a protrusion holding C1 and C2 together, or if that is entirely absent, then you have the opportunity for movement. Let me turn this way, both forward and backward, where C1 and C2 can be unstable at that joint. This presents a problem with two kinds of movement. So the one that's most common is extension of the cervical spine, moving back. So that's where you tend to get issues both from ligament laxity and from an issue in that process off of C2. So because of that, for people with rheumatoid arthritis, you want to be cautious about extension of the cervical spine. And what I encourage people to do, instead of dropping the head all the way back, is to just lift the gaze slightly. And what we teach in our trainings is to look up to the seam where the wall meets the ceiling. Okay, so if I look up to where the wall meets the ceiling, it's just going to be a gentle extension, and I'm not going to be throwing my head all the way back, not trying to look all the way up at the ceiling. So what happens if you do have C1, C2 instability and you extend the neck fully, you can compress the spinal cord. And there are all kinds of issues that can happen in terms of especially the extremities, numbness, tingling, problems with walking, problems with moving, problems with balance, risk of falls from compressing that vertebrae, in addition to pain, etc. Okay, what was pointed out to me, however, is something that I was unaware of, which is that it can also be a problem for folding forward with the cervical spine. And so while this is not a common issue, it's possible. And so you perhaps want to also be careful that flexion of the cervical spine is gentle. Now, the only way to determine whether someone has C1, C2 instability is for their doctor to do an x-ray and to look and see whether there's instability, whether there is an issue with the bony protrusion or an MRI, or especially movement in those positions. So it's possible for a doctor to do that screening and for the student or client to tell you, oh, I don't have that issue. But if you're unable to get that information, even though it's a small percentage of people with RA who have that, you want to be cautious and not make sure to, well, essentially to practice ahimsa and do no harm. So to be conservative with flexion and extension. And for those of you who have RA yourselves, this is something that you can ask your rheumatologist, whether you may have C1, C2 instability. Let them know that you're practicing yoga and you want to make sure to keep your neck and your spinal cord safe. And in the meantime, you can certainly use extra caution and avoid going to the end of your range in either flexion or extension. I hope that this has been helpful. If you have any additional questions about this particular issue, please let me know. But in general, please keep the questions coming because I love to answer them and hopefully provide you with some useful information. Thank you very much.